Perfect. It's all working. Yeah, so I'm actually standing here in what will be one of our patient wards. Here, let me see if I can give you a view here.
Oh, wow.
How
many patients can you have there?
One of the patient wards. It doesn't look like much yet because it's still concrete everywhere, but
well, we understand that, but how many patients can you have there?
Yeah, so each ward room is set up for 10 patients. You know, it's a primary care center, but we'll be doing a full range of services. So it'll like even short-term hospital stays for 1 or 2 days, and we'll have a capacity for about 20 inpatients at a time. And so this is one of 2 wards like that. So you can see we've got some high ceilings and we've got some tall windows, which is very important for infection control. So sorry, I'm a terrible camera person. It's not
doing great. You're doing great.
My strength here.
Ari, you're doing great.
Yeah. It's good to see you, and I'm really happy to get to connect to you from here.
Let me ask you, you have doctors on staff who can take care of these patients?
Yeah, absolutely. Absolutely. Well, we're going to be hiring an entire, a 33-person medical staff for this facility. Oh my God.
And will they all be local?
And yes, they will all be local. They will actually be complemented by another 65 community health workers who will be in the field treating people in their homes and then bringing patients in who need care, who can't get care in the home. So most care is still going to happen in the home. And then we're going to bring in the patients who are the sickest, who can't get care in the home, to this facility.
What do you find in Mali is the #1 sickness?
You know, the #1 cause of death in these areas is delayed access to healthcare, not getting care in time. No matter whether you have, God forbid, a heart attack or cancer or pneumonia or diarrhea, when you get care matters the most. And so that's what we're really focused on. How do we imagine and then build a healthcare system that reaches every patient as fast as possible? We just got our June results in, and across all of our sites, we reached 78% of the sick patients within 24 hours of their first symptom. Wow. And as far as we know, that's the fastest healthcare system in the world operating here in Mali. Wow. I don't know of a healthcare system anywhere that reaches patients earlier on average.
That's incredible.
So the diseases that we'll treat here are diseases like malaria and pneumonia, diarrheal disease. Those are the leading causes of child death. They can also knock adults down too. I got actually very sick with a gastroenteritis, a dysentery, earlier this week. My blood pressure dropped about 30 points, and I went from being in my totally normal state of health to barely able to stand up out of bed in the space of about 5 hours of violent projectile vomiting on Tuesday. It happened so quickly. And it was a real reminder to me of how much it matters being able to get people care quickly. And because I was fortunate I was right here in this area, and I was fortunate to be able to connect with care quickly and bounce back.
Well, being a doctor, married to a doctor, helps.
Yeah, and you know it does, and still it helped so much to be in the middle of this healthcare system with Muso, and to have community members reach out to me at my doorstep and ensure that I got testing for malaria, and I got any treatment that I needed in the home, and that when I needed more care, make sure I got that care at the nearest qualified facility. And so even as a Harvard-trained doc, in that moment, I was really sick. I couldn't even think straight. I could barely move. And so I really needed to help. And I was so grateful for it.
Thank goodness it was there.
Yeah.
I have a question. The big windows, is that to open them? Do you get enough fresh air? It's not too hot?
Yeah, so the big windows are for a few reasons.
Right.
The most important reason for the big windows is infection control. And that's infection control from light and from airflow. So when we have an open ward here, right? So when this opens, we're going to have, a good, is a big enough ward for up to 10 people to be hospitalized at the same time. And so for that to be safe from an infection control perspective, we need big windows for lots of airflow and also for lots of natural light, both of which kill microbes pretty effectively.
Got it.
And is there usually a breeze?
Right now there's a nice breeze. The climate in Mali is tough. We are in the rainy season right now, and a bunch of roads are flooded. We're in the middle of an urban area here where I am standing right now. It's actually one of the fastest growing urban areas in the world. But even in the middle of this rapidly growing urban area, it took us over a half hour driving off-road through flooded dirt paths to make it to this health center. So it's kind of a paradox of, you're in a densely populated urban area, but access to care in this context can be really tough. Yeah.
I hope it's not too tough for the patients and for the doctors.
Yeah, well, that's why this health center is so important, because once it opens, it's going to make healthcare for this entire surrounding area much more accessible. We're building this in an area, it's a site of 2 years ago, a major measles outbreak, because parents didn't have a health center close enough to get their kids vaccinated. So even though it's an urban area, community members here have had to travel as far or farther than some patients in rural areas to get care.
And where does the funding come from? You got a big program of doctors and buildings now, and it's got to be not more than $2.98 to run this operation.
Yeah,
so you have both capital and operating costs, right?
Yeah, absolutely. So we have, we are working, we've set a big goal of raising $60 million over the next 3 years. Yeah. And that's $60 million. Oh my gosh.
And we pros. Quite the challenge.
Yeah, so we're working to provide healthcare to over 700,000 people over the next 3 years, and conduct research and change national policies for tens of millions of people. And fabulous. We have
Fabulous.
We're bringing together a consortium of about 50 plus partners, so very diversified, each contributing a little bit to that goal. Individuals and foundations, basically. Yeah. So our vision, our dream is that no one should die waiting for healthcare anywhere, right? And kid born anywhere should have a reasonable shot at making it to age 5 to kindergarten. And yeah, we're within sight of the first communities where we worked, which had some of the highest rates of child death in the world, and that today have rates of child survival similar to that of the US. So yeah, I feel really hopeful about what we're building together. Got a lot more work to do, but I'm excited about it.
Oh, good for you. I think it's wonderful what you're doing.
We're doing it together. I think really grateful to be part of the prize community and to get for this to be part of to be bound up in Jewish community, which has been so important for my path that brought me here.
Right. So God bless it. Shabbat Shalom and Shana Tova. We don't see you before.
You have a wonderful Shabbat. Yeah, I hope you have a great Shabbat. I'm excited about my Shabbat here in Yeri Majo. And I'll be thinking about you guys.
Okay, God
Great
bless.
seeing you. We'll see you soon in person.
Yes.
Bye,
Yes.
Ari.
All right,
Bye,
take care.
Bye, God bless.
Bye.